Hi, my name is Tayler Trotter, and I'm an associate marriage and family therapist and associate professional clinical counselor working with HearYou.org. I'm here in partnership with Brother Be Well today to discuss the topic of noticing grief in children. So, while navigating grief is difficult for many adults, the signs of grief can look different in children. Many children know of death but have difficulty understanding this full process. By allowing children to express their thoughts, feelings, and emotions in times of grief, it can positively affect their ability to learn helpful coping skills when needed. One of the things to keep in mind when it comes to grief in children specifically is that children may experience a change in their mood. So they may be crying in one moment and experiencing sadness, and then laughing in the next and playing with others. And this doesn't mean that they're no longer feeling sad, but it can be a defense mechanism to manage any overwhelming emotions they might experience through this process. Sometimes we also see a regression in behavior, and that can also be experienced in younger children, such as wetting the bed or speaking in baby talk as well. Ways to support your child throughout this grieving process. One is just encouraging them to discuss their feelings. Now, many children don't have the ability to fully verbally process what they might be feeling. So, reading different books about death can help the child understand what is happening. And then, alternatives such as drawing or telling stories about the lost loved one can be really helpful for them to understand. When we are speaking with our children, though, we want to ensure that we're being developmentally appropriate as well. So younger children may think that their lost loved one will be coming back at some point in time, while other children that are older may understand the permanence of death and have questions. It's important for us to allow these questions to be asked and answer as honestly and clearly as appropriate. Some of our older teens may feel as though they're burdening their family members by discussing how they might be feeling. So, by opening up the conversation and even just checking in, it reinforces that it's okay to discuss this topic, even if maybe they aren't ready to do so at this moment. If you're noticing that your child is having a really difficult time adjusting to the death of a loved one, it can also be helpful to take them to their primary care physician for additional support. It's also important for the parent or caregiver to not ignore their own grief throughout this process. Your expression of your emotions reassures the child that it's okay to feel sad, angry, upset, whatever they might be experiencing in the moment. And it's also okay for you to reach out to a medical or mental health professional if you might need some support in navigating this process as well. So again, my name is Tayler Trotter with HearYou.org, reminding you, brother, be well.